Management and treatment of hypertension. 1. Diet. 2. Causes. 3. Symptoms. 4. Signs. Hypertension is another name for high blood pressure. It can lead to severe health complications and increase the risk of heart disease, stroke, and sometimes death. Blood pressure is the force that a person's blood exerts against the walls of their blood vessels. This pressure depends on the resistance of the blood vessels and how hard the heart has to work. Almost half of all adults in the United States have high blood pressure, but many are not aware of this fact. Hypertension is a primary risk factor for cardiovascular disease, including stroke, heart attack, heart failure, and aneurysm. Keeping blood pressure under control is vital for preserving health and reducing the risk of these dangerous conditions. Management and treatment. Lifestyle adjustments are the standard, first-line treatment for hypertension. We outline some recommendations here. 1. Regular physical exercise. People can measure blood pressure using a sphygmomanometer. Current guidelines recommend that all people, including those with hypertension, engage in at least 150 minutes of moderate intensity, aerobic exercise every week, or 75 minutes a week of high-intensity exercise. People should exercise on at least 5 days of the week. Examples of suitable activities are walking, jogging, cycling, or swimming. 2. Stress reduction. Avoiding or learning to manage stress can help a person control blood pressure. Meditation, warm baths, yoga, and simply going on long walks are relaxation techniques that can help relieve stress. 3. People should avoid consuming alcohol, recreational drugs, tobacco, and junk food to cope with stress, as these can contribute to elevated blood pressure and the complications of hypertension. Smoking can increase blood pressure. Avoiding or quitting smoking reduces the risk of hypertension, serious heart conditions, and other health issues. 4. Medication. People can use specific medications to treat hypertension. Doctors will often recommend a low dose at first. Antihypertensive medications will usually only have minor side effects. Eventually, people with hypertension will need to combine 2 or more drugs to manage their blood pressure. Medications for hypertension include diuretics, including thiazides, chlorthalidone, and indapamide beta blockers and alpha blockers. Calcium channel blockers, central agonists, peripheral adrenergic inhibitor, vasodilators, angiotensin converting enzyme, ACE, inhibitors, angiotensin receptor blockers. The choice of medication depends on the individual and any underlying medical conditions they may experience. Anyone on antihypertensive medications should carefully read the labels of any over-the-counter, OTC, drugs they may also take, such as decongestants. These OTC drugs may interact with the medications they are taking to lower their blood pressure. 5. Diet. People can prevent high blood pressure by following a heart-healthy diet. Reducing salt intake. People's average salt intake is between 9 grams, g, and 12 grams per day in most countries around the world. The World Health Organization, WHO, recommend reducing intake to under 5 grams trusted source a day to help decrease the risk of hypertension and related health problems. Lowering salt intake can benefit people both with and without hypertension. Moderating alcohol consumption. Moderate to excessive alcohol consumption can increase blood pressure. The American Heart Association, AHA, recommend a maximum of 2 alcoholic drinks a day for men and 1 for women. The following would count as 1 drink: a 12-ounce Oz bottle of beer, 4 ounces of wine, 1.5 ounces of 80 proof spirits, 1 ounce of 100 proof spirits. A healthcare provider can help people reduce consumption if they find it difficult to moderate their alcohol intake. Eating more fruit and vegetables and less fat. People who have high blood pressure or people at high risk of developing high blood pressure should eat as little saturated and total fat as possible. Instead, experts recommend whole grain, high fiber foods, a variety of fruit and vegetables, beans, pulses, and nuts, fish rich in omega-3 twice a week, non-tropical vegetable oils, for example, olive oil, skinless poultry and fish, low-fat dairy products. It is important to avoid trans fats, hydrogenated vegetable oils, and animal fats, as well as large portion sizes. Some fats, such as those in oily fish and olive oil, have protective effects on the heart. However, these are still fats. While they are typically healthful, people with a risk of hypertension should still include them in their total fat intake. Managing body weight. Excess body weight can contribute to hypertension. A fall in blood pressure usually follows weight loss, as the heart does not have to work so hard to pump blood around the body. A balanced diet with a calorie intake that matches the individual's size, sex, and activity level will help. Conditions that can lead to hypertension include diabetes, due to kidney problems and nerve damage, kidney disease, pheochromocytoma, a rare cancer of an adrenal gland, Cushing syndrome, that corticosteroid drugs can cause congenital adrenal hyperplasia, a disorder of the cortisol-secreting adrenal glands, hyperthyroidism, or an overactive thyroid gland, hyperparathyroidism, which affects calcium and phosphorus levels, pregnancy, sleep apnea, obesity. Risk factors. A number of factors increase the risk of hypertension. Age. Hypertension is more common in people who are more than 60 years of age. Blood pressure can increase steadily with age as the arteries stiffen and narrow due to plaque buildup. Ethnicity. Some ethnic groups are more prone to hypertension than others. African Americans have a higher risk. Trusted source than other ethnic groups, for example. Size and weight. Being overweight or obese is a primary risk factor. Alcohol and tobacco use. Regularly consuming large quantities of alcohol or tobacco can increase blood pressure. Sex. According to a 2018 review. Trusted source, males have a higher risk of developing hypertension than females. However, this is only until after women reach menopause. Existing health conditions, cardiovascular disease, diabetes, chronic kidney disease, and high cholesterol levels can lead to hypertension, especially as people age. Other risk factors include sedentary lifestyle, salt-rich, high-fat diet, low potassium intake, poorly managed stress, and a family history of high blood pressure can also contribute to the risk of developing hypertension. Below is a 3D model of hypertension, which is fully interactive. Symptoms. Most people experience no symptoms from hypertension and may not be aware they have it. A person with hypertension may not notice any symptoms, and so people often call it the silent killer. Without detection, hypertension can damage the heart, blood vessels, and other organs, such as the kidneys. It is vital to check blood pressure regularly. In rare and severe cases, high blood pressure causes sweating, anxiety, sleeping problems, and blushing. However, most people with hypertension will experience no symptoms at all. If high blood pressure becomes a hypertensive crisis, a person may experience headaches and nosebleeds. Complications. Long-term hypertension can cause complications through atherosclerosis, where plaque develops on the walls of blood vessels, causing them to narrow. This narrowing makes hypertension worse, as the heart must pump harder to circulate the blood. Hypertension-related atherosclerosis can lead to heart failure and heart attacks, aneurysm, or abnormal bulge in the wall of an artery that can burst, kidney failure, stroke, amputation, hypertensive retinopathies in the eye, which can lead to blindness. Regular blood pressure monitoring can help people avoid these more severe complications. Learn more about atherosclerosis here. Signs. A sphygmomanometer, or blood pressure monitor, can help people keep track of their blood pressure. A doctor's visit is not always necessary for blood pressure monitoring. Home blood pressure monitors are available for purchase online. Having high blood pressure for a short time can be a normal response to many situations. Acute stress and intense exercise, for example, can briefly elevate blood pressure in an otherwise healthy person. For this reason, a diagnosis of hypertension requires several readings that show sustained high blood pressure over time. The AHA issued guidelines in November 2017 that define hypertension as blood pressure that is consistently higher than 130/80 mm of mercury, mmHg. The systolic reading of 130 mm of mercury refers to the pressure as the heart pumps blood around the body. The diastolic reading of 80 mm of mercury refers to the pressure as the heart relaxes and refills with blood. The AHA 2017 guidelines define the following ranges of blood pressure: systolic, mmHg, diastolic, mmHg, normal blood pressure less than 120 less than 80 elevated between 120 and 129 less than 80 stage 1 hypertension between 130 and 139 between 80 and 89 stage 2 hypertension at least 140 at least 90 hypertensive crisis over 180 over 120 if the reading indicates a hypertensive crisis, wait 2 or 3 minutes and then repeat the test. If the reading is the same or higher, this indicates a medical emergency. The person should seek immediate assistance at the nearest hospital.